federal employee health benefit plans cover current and retired government employees and work with Medicare differently than other employer plans. Um, but how do those benefits coordinate with Medicare, and what do you need to consider when making enrollment decisions? Here to talk with me about that is Jae Oh, author of Maximize Your Medicare. Jay, welcome.
Thanks for having me, Bob.
All right, another complicated topic for you.
FEHB is an enormous program. It is the single largest employer when it comes to providing healthcare benefits to employees in the nation. And so, notably, that the number of options that federal employees, either active or retired, have is mind-boggling and can be easily confused. I think the main thing that people can take away is that if you wanted to adopt a FEHB plan under retirement, that is entirely possible. That said, the complication becomes the enrollment rules regarding Part B, as well as your ability to switch, meaning can you cancel your FEHB plan and go back? These are handled differently for FEHB annuitants, is their proper word, compared to retirees from almost any other type of employer.
So, is how similar or dissimilar is FEHB healthcare benefits compared to Medicare?
So, first of all, in order to get an FEHB plan, for example, there can be Medicare Advantage plans which are part of FEHB, meaning that you're an annuitant and you have a non-Medicare spouse or family member, and so you'll want to stay on FEHB. That is entirely reasonable. There are now Medicare Advantage plans that you can be a part of that are part under the umbrella of the FEHB. And certainly those have gained wide acceptance by annuitants. The issue is that if you want to change to Medigap, because in order to do that, you actually cannot be part of FEHB under the way the rules currently work. If you were to leave FEHB and enroll in a Medigap plan, then you would need to find other insurance for your spouse and family members. And that creates the complication. And then there's the entire different avenue or arena of price regarding the cost of FEHB compared to the private market.
So when folks are making enrollment decisions, I take it it's not based solely on cost, but all the typical factors that you might consider, whether you are going to stay on Medicare Original or Medicare Advantage?
It's very, very dizzying when it comes to FEHB. The one good thing is that, as FEHB annuitants would know, that the acceptance of whatever FEHB plan that you've chosen, and it is very dizzying. In other words, it is multiple hundreds per state of choices that a person could have, is that the acceptance regarding the quality of network is, generally speaking, very, very high. So as a result, particularly PPOs are almost universally accepted by many of the healthcare providers, irrespective of your location. That said, what you have is the situation of whether or not the total cost to a household is efficient. And that one is very difficult to kind of summarize in just a couple of moments that we have. But what I would say is that there can be situations where it is best to stay on your FEHB plan and find the option within FEHB that meets the needs of not only the annuitant, but the extended family.
And what about when it comes to prescription drugs, also including in a FEHB plan?
Sure, prescription drug cost and prescription drug benefits are almost universally included in the Medicare Advantage plans that are available inside an FEHB plan. In fact, I don't remember ever seeing one that did not include prescription drug plan benefits.
So, in many cases, given the complications and the vast array of choices, working with a competent professional is perhaps called for.
It can be. That said, the documentation or the guides that the FEHB provide are amongst the most comprehensive that you would need to dig. And I'm not going to say it's going to be easy, but it is possible that somebody actually does the research themselves. That said, could they go to private counsel, private guidance just for a one off, a second set of eyes? That might also be advisable.
Jay, we've covered a lot. Anything we missed or bears reemphasizing?
I think what happens under FEHB is that we've talked in broad terms, nationwide. And what I think that people can keep in mind is the fact that location will matter a lot here because FEHB benefits, while very comprehensive in the terms of their coverage and acceptance, that the cost points do vary greatly from location to location. It can be that Medigap and private and federal Medicare can be more efficient from a cost perspective. But then again, please remember that if you cancel your FEHB benefits, then you cannot re-enter. However, if you suspend, which is a nuance, is it possible to suspend FEHB and return? It is possible. That said, that really only applies for people without a spouse, without others that require the coverage as a part of an FEHB family, if you will.
And Jay, I assume that some of this is mentioned in your book, Maximize Your Medicare.
Sure, Maximize Your Medicare does include some of these, and most of what we've talked about here, if not all, to be candid, that this is with such a large population that it is important to understand. And of course, this is a large, important group of the Medicare population for sure.
Well, as always, Jay, thanks for sharing your knowledge and wisdom with us. It's greatly appreciated. Thank you.
Thank you for having me, Bob.